So when it comes to the treatment options for arthritis, one thing I always want our patients to understand is with me and with all of my partners at the Campbell Clinic, our number one goal is really to get you better without cutting on you if we can. We have a lot of options for helping you do the things that you want to do and to be active that don't involve surgery. For ankle arthritis, there are things such as braces, simple braces that can go onto our ankle underneath our shoes and clothes that you'll never see that can really give you support and allow you to do the activities that you would like to do. There are great medications that we can prescribe that you can take by mouth. There are also medications like steroids that can be injected into the ankle to calm down the inflammation and the pain and allow you to be active. I frequently tell my patients that the purpose of life is to be up and active and taking steps and moving. And if I can help you do that without cutting on you, I will do that every time. There are some situations, though, where those simple things, those non-surgical things, just stop working. And when that happens, that's when it's time to start discussing surgery. In most situations, when we're talking about arthritis of the ankle, the patient is going to be telling me when it's time for surgery, more than me telling the patient, because they're going to hit that point where all of those non-surgical things just aren't allowing them to do the things that they want to do. And when it's time, we have a lot of different options to address arthritis of the ankle. Most treatments for the ankle arthritis really come down to either procedures that are going to take away the joint or procedures that are going to preserve the joint. Taking away the joint is called a fusion or an arthrodesis. What that means is that we take out whatever cartilage is actually remaining in the joint and we make what used to be two bones grow into one bone. If we look at an ankle, the ankle is really the joint between the tibia bone and the talus bone. There is normally motion at this joint, but as the cartilage gets worn away, it can become very painful in that area. So for a fusion of the ankle, we go in and take out the cartilage of this joint, and then we use hardware that's placed across the joint in order to stabilize the joint, and over time, over about 6 to 8 weeks, what used to be two bones now becomes one bone. There will be less motion after a fusion operation. However, when a patient gets to the point where we're talking about a fusion, they've already lost most of the motion of the ankle. They're already stiff. And so most patients actually feel like they have more motion after an ankle fusion because we've taken away the pain. An ankle fusion is a great operation for pain relief. And in many patients, if you watch them walk after an ankle fusion on one side, you really can't tell which side is fused. So it can be a common misconception that after an ankle fusion, they're going to limp or they're going to walk funny. In reality, most of these patients are already limping due to the pain from the ankle arthritis, and that pain goes away after this procedure. No procedure is to be taken lightly. There can be risks anytime we do the operation. People can have infection, wound healing problems. Those risks are very low, but they're not zero. The biggest risk in this situation is if you continue to live with the ankle arthritis and you're not able to do the things you want to do, that's when we start to become less active. That's when we start to gain weight and things like heart disease and diabetes become more common. And so we really want to act when the patient is starting to lose the ability to be active and do the things that they want to do. For an ankle fusion, it's an outpatient operation in the majority of patients. Patients come in and go home the same day. This is done at our surgery center here at Campbell Clinic. We do a great job of taking care of the pain after the procedure, and it actually starts before the operation. Patients routinely receive nerve blocks for this, where it really numbs up the ankle for several days after the procedure. And there are great medications that help control pain without taking a lot of narcotic pain medicine. For most patients after this operation, they're going to be in a splint or a cast for the first couple of weeks until the wound is healed. Once the wound is healed, the stitches come out, and we then go into another splint or another cast to keep things stable, to keep things immobilized for a total of about 6 to 8 weeks. During that period of time, most patients are using either a knee scooter or crutches or something to keep their weight off of the leg to allow the biology to do what it needs to do to heal those two bones together. At that 6 to 8 week mark, we then start walking on it. Patients go into a walking boot and begin physical therapy to relearn how to walk without a limp again. Most patients are hitting a full recovery somewhere around 10 to 12 weeks after the operation. People can have swelling up to a year or so after the procedure, but that first 3 months is really when most of the recovery is occurring after that type of surgery. The activities that people can do after a fusion are still a lot of different activities. Things like bike riding are wonderful activities. Some studies actually show that we're even better riding a bicycle after an ankle fusion than before, because you now have a rigid lever arm at the ankle and you're able to more efficiently transfer energy to the pedal. Things like running, marathon running, can definitely be more challenging after an ankle fusion. Most patients, though, when they get to the point where they're talking about the ankle fusion, they've already kind of adapted and given up some of those more high-demand activities to start with and aren't really looking to get back into that. But things like walking, swimming, bike riding, hiking, those are all excellent activities that we can all enjoy even after an ankle fusion. Ankle replacement is another option for treatment of ankle arthritis. With an ankle replacement, we're really trying to preserve what motion is left in the ankle after the operation. Notice that I didn't say improve the range of motion, because with an ankle replacement, the goal is not to get more motion. A lot of studies show that the amount of motion we have before the ankle replacement is about the amount of motion we're going to have after the ankle replacement. But that little bit of extra motion really does help. Patient satisfaction scores are typically higher after an ankle replacement than an ankle fusion. What an ankle replacement is it involves a procedure where we actually go into the front of the ankle joint and we take out what cartilage remains and cut the bone in a certain way to put in a mechanical device, an actual implant in the ankle that still permits motion to occur in the ankle. Very, very effective for pain relief. The problem with an ankle replacement can be it is a mechanical device. These can wear out over time. We don't have the same data for ankle replacement that we do with joint replacements like knees and hips. They're just not the same. Most patients, we can reliably tell them that 10 to 15 years is a very, very good estimate for how long that ankle replacement should last. However, some studies show that maybe perhaps they'll last longer. The newest implants don't have that long of data to where we can really say, is it going to last longer than 10 to 15 years? Revising an ankle replacement is another option down the road after it wears out, where you can put in a revision total ankle replacement. The problem with an ankle replacement is the complications can be higher than an ankle fusion in some situations. When the ankle wears out, if we try to revise this to an ankle fusion, we've actually cut away a lot of the bone that would normally be there to do a fusion to put in the ankle replacement. So revising an ankle replacement to an ankle fusion is actually a very challenging thing to do. That's why we usually consider revision ankle replacement if needed. After this sort of surgery, the patients are typically not walking on it for about 4 weeks. Once the wound is healed, then we go into a boot and allow them to start putting weight on it at that time. They then begin physical therapy to improve their range of motion, and then get back to regular activities around 8 to 10 weeks or so after the operation. Patients are unrestricted in terms of walking, bike riding, swimming after this sort of procedure. Running is something where if that's really what a patient wants to do, I won't restrict it, but keep in mind it is a mechanical device. And so the more cycles we're putting on it, the more it can wear out. Ankle replacement is a great option as we get older and have less demand on our ankle. For ankle arthritis in young patients or patients with significant deformity where the ankle is turned one way or the other, an ankle fusion is definitely a much more reliable operation in those situations.